Hello, my name is Karita Johnson, and this is my advanced health assessment. I've asked the patient to empty his bladder. I've taken a full set of vital signs, including height and weight, and I've assessed his vision with the Rosenbaum and the Snellen charts. And then I asked him to get undressed and placed on a gown. So we're going to start the assessment with inspection of the head and face. So I'm going to be looking at the head and face. I'm looking for symmetry of the eyes. I'm looking at the nose. I'm looking at the mouth. I'm looking at the alignment of the eyes and the ears. I'm looking at the scalp and the skull. I'm looking for even distribution of hair and the texture of hair. So the next thing I'm going to be doing is I'm going to be palpating the scalp. And it looks nice and freely as well. And then we also didn't see any lesions or kind of nodules on the skin of the face. So the next thing that we want to do is we want to palpate the facial bones for any tenderness. Any tenderness?
No.
Okay. So that felt nice and normal there. So the next thing that we want to do is we want to palpate the temporomandibular joint. Have you opened your mouth for me? And close. Do you feel any crackiness, any popping, no TMJ, no tenderness, right?
No.
So the next thing that we want to do is we want to assess the maxillary and the frontal sinuses. I'm going to palpate those. Any tenderness?
No.
Any tenderness? No tenderness. I didn't feel any kind of swelling or any kind of abnormalities there. All right, so the next thing that we want to do is we're going to conduct a neural examination and assess the cranial nerves. Cranial nerve 1 is the olfactory nerve. It's for the smelling. It's not required for this assessment. Cranial nerve 2 is the optic nerve, and it was assessed when we did the vision testing. Cranial nerves 3, 4, and 6 will be assessed when I conduct the eye exam, and cranial nerve 5 I will assess them. I'm inspecting his face for any kind of muscle atrophy or any kind of tremors. I don't know anything. Can you squeeze your eyes really tight for me? Okay, you can open them, and that's nice and normal. So now we will look at cranial nerve 7. Can you smell for me? Can you crack? Puff out your cheeks and rub your forehead. So that's definitely nice and normal. Cranial nerve 8 will be assessed when we assess his ears, his hearing. So cranial nerve 9 and 10. I'm going to assess your gag reflex. Open your mouth for me. Okay, that's good. Gag reflex was nice and tight. So now we're going to assess the reflex. Okay, so the uvula is nice and midline. I noticed elevation of the soft palate when we did that. So that's definitely nice and normal. Next thing we have you do is shrug your shoulders. Now have you shrug them again against resistance. And that was nice and normal, so that was good there. All right, so the next thing I want you to do is turn your head side to side. Now against resistance. Up to the ceiling, against resistance. Down to the floor, against resistance. So that was definitely nice and normal, and that's what we want to see. Now have you stick your tongue straight out. Up to the ceiling, down to the floor, left, right. Now against resistance, against resistance. Okay, so that was nice and normal. So the next thing that we're going to do is we're going to test the sensation for soft and sharp touch. And have you close your eyes and then touch it with a cotton tip applicator. You let me know if it's a soft or sharp sensation. Forehead.
Soft. Sharp.
Cheeks.
Sharp. Soft.
Chin.
Soft. Sharp.
Shoulders.
Soft. Sharp.
Arms.
Soft. Sharp.
Hands.
Sharp. Soft.
Thighs.
Sharp. Soft.
Legs.
Sharp. Soft.
Feet.
Sharp. Soft.
Okay, so that was nice and normal. So the next thing that we're going to move along to is we're going to move into the eye assessment. So I'm looking initially at his eyes. I'm noting that they're symmetrical on the face. I'm noting their placement. I'm noting the eyelashes and the hair distribution. Even hair distribution is growing out and up. I'm noting the eyelids. I don't see any turning in or turning up of the eyelids. I'm also looking at the eyelashes. I don't notice any crossing of the eyelashes. I'm assessing the sclera. The sclera are nice and white. I don't notice any redness or not injected. And I don't know any kind of jaundice there as well, or exudate. Next thing I'm going to do is look at the conjunctiva. Conjunctiva are nice and pink. I don't notice any redness. I don't notice any exudate there. So the next thing I would do is I would palpate the lacrimal apparatus. Any kind of tenderness?
No.
And I don't know any kind of masses or any kind of bulges. So the next thing I will assess is cranial nerves 3, 4, and 6. So we'll start with the pupillary response. Direct and consensual. Direct. Direct. Consensual. Consensual. So the next thing we're going to assess is 6 cardinal fields in the extraocular eye movement. I'll have you focus on the tip of the pen light. You just follow it for me. Okay, so that was nice and normal. I did not notice any kind of nice stagnance there. And extraocular eye movements are full and intact. So the next thing that we're going to do is we're going to assess the cover and the uncover test. And we're going to be looking for any kind of strabismus or weakness. I'll have you focus on an object over my shoulder. And you're going to cover one eye, then uncover, and do it on the opposite eye. Left eye, uncover. That's normal. Right eye, uncover. So it's nice and normal. I definitely didn't notice any kind of strabismus or any kind of weakness for the eye. All right, so the next thing that we're going to do is we're going to assess his ears. I'm going to start off with the inspection of the ears, and I'm looking at the external characteristics of the ears, and I'm looking at their alignment on the head. I don't see any lesions or any kind of nodules. I don't know any excess serum coming out of the ear canals as well. All right, so the next thing I want to do is I want to palpate the auricles for any tenderness or any kind of warmth. No warmth, no lesions or nodules. Is that tender at all?
No.
So that's definitely nice and normal. So now we'll assess cranial nerve 8 with the whisper test. I'm going to stand behind you and whisper a word. We're going to cover one ear, repeat the word, cover the other ear, repeat the word.
Green. Yellow.
Okay, so that's nice and normal there. So the next thing that we're going to do is we're going to conduct the Weber test. So I'm going to strike the tuning fork, place it on the top of your head. And then you're going to let me know if you hear it in left ear only, right ear only, or if you hear it in both ears.
Both.
Okay, that's nice and normal. So next we'll conduct the Ryan test. I'm going to strike the tuning fork, place it on my mastoid bone, and you're going to let me know when you stop feeling it. Then I'll place it next to your ear and let me know when you stop hearing it.
No.
Okay, so that was a normal test. Air conduction is about twice as long as bone conduction, and we would definitely be repeating that in the opposite ear. So now I'm going to inspect the ear with the otoscope. I'm looking in the inner ear and the tympanic membrane for any kind of abnormality. I'm looking in the inner ear canal. I don't see any excess serum. I'm looking at the tympanic membrane. It's nice and pearly gray. I don't see any redness or any bulging. Looking at the inner ear canal, I don't see any excess serum in the tympanic membrane. It's nice and pearly gray with no redness or no bulging noted as well. So now we'll assess his nose. So I'm inspecting the nose itself. I'm just looking for, symmetry of the nose. I'm looking at the septimus midline, and I'm looking for any obvious drainage, any kind of lesions, or any kind of crusting. So next thing I'm going to do is assess the patency of each nostril. Have you place a finger over each nostril, inhale and exhale one at a time. Okay, so the nostrils are definitely patent. So the next thing I'm going to do is I'm going to assess inside of the nostrils with the otoscope. Let me change the tip of the otoscope. Okay, so now I'm just looking inside the nose. I'm looking at the nasal mucosa. It's nice and pink. I don't see any redness or swelling. The nasal septum is nice and midline. There's no deviation. And the turbinates are normal. I don't notice any kind of polyps or any kind of abnormalities within the nose there. So now we will assess the mouth and the pharynx. I'm looking at the external characteristics of the mouth itself. The color is appropriate for race. I don't see any kind of lesions. I don't see any kind of cracks, fissures, or lips are moist. I don't see any kind of cyanosis. Okay. So now we're going to assess inside of the mouth. So I'm looking in the back of the mouth. I'm looking at the interior and posterior pillars. I'm looking at the posterior pharynx. Everything looks normal there. The uvula's nice and midline. The tonsils are 1+. I don't see any abnormalities there. So I'm looking at the buccal mucosa. It's nice and pink. I'm looking at the blood vessels. They're intact. I'm looking at the hard and soft palates. They're nice and pink. I don't see any abnormalities there. I'm looking at the tongue. And the tongue is nice and smooth. I don't see any coating. It's not furry. And it's symmetrical. I don't see any lesions or any kind of blisters there. I'm looking at the gums themselves. The gums are nice and pink. I don't see any blisters or abscesses. I'm looking at the teeth. The teeth are nice and white. They're all intact. I don't notice any kind of cavities or any kind of cracking there. So the teeth are normal. They look nice and intact. So the next thing that I'm going to do is I'm going to be inspecting his neck. So I'm looking at the neck itself. I'm looking at the muscle mass. It looks nice and symmetrical. I don't see any obvious tracheal deviation. I don't see any obvious borders. The thyroid looks nice and smooth. Now I'm going to look for jugular venous distension. Turn your head to the left. I don't see any jugular venous distension there. Turn your head to the right. And I don't know any jugular venous distension there. So the next thing that I'm going to do is I'm going to assess a passive and active range of motion of the neck. Can you turn your head side to side? Now against my hand. Now against my hand. Up to the ceiling. Now against my hand. Down to the floor. Now against my hand. So that's nice and normal. Shrug your shoulder. Shrug them again against resistance. Okay, so that's nice and normal there. All right, so next thing I want to do is I want to palpate the carotid arteries. I'm going to do that separately. Nice and strong pulse. Nice, strong, and equal pulse as well. So then the next thing that I want to do is I'm going to be palpating the thyroid and palpating the trachea. Okay? So I'm palpating the thyroid, ensuring that it's nice and midline. I don't notice any deviation. I'm palpating the thyroid. It's nice and smooth. No nodules or gutters are noted. Can you swallow for me? Okay, that was good. I felt nice and movement when he went ahead and swallowed for me. Next thing that I want to do is I want to palpate the lymph nodes. So we'll start with the preauricular lymph nodes. Then we'll do the post-auricular lymph nodes and the occipital. And then we'll move down to the tonsillar, submandibular, submental. Okay, so anterior and posterior cervical chains, the deep cervical, supraclavicular, and the infraclavicular as well. Put your arms up for me. And we're going to palpate the axillary lymph nodes as well. And there's nice and normal. I don't feel any kind of abnormalities there. So the next thing that I want to do is I want to auscultate the carotid arteries and thyroids. I'm looking for any kind of broids. I'm going to do that with the bellow stethoscope. Have you hold your breath for me. Now breathe. Hold your breath for me. Now breathe. Hold the thyroid. Okay, so that was nice and normal. There were no broids auscultated. So the next thing that I'm going to move on to is assessing the upper extremities. I'm looking at the upper extremities themselves. I'm looking at the skin. I don't notice any kind of lesions, any moles, or any kind of abnormalities, no breakage. Okay. I'm also looking for the muscle mass is nice and equal, and I'm going to palpate down the arms and the joints as well. So I'm palpating the muscle mass, so it's nice and equal. I'm palpating the joints. Can you extend your arm and bend it? I don't feel any kind of crackers or anything there when he did that, and it felt nice and normal. So when I look at his fingers, I'm looking at his fingertips. I don't notice any obvious clubbing or any obvious cyanosis. Capillary refills less than 3 seconds. It's nice and brisk. The nails themselves are nice and clear. I don't see any splitting or cracking of the nails. So the next thing I'm going to do is palpate the brachial pulses, nice and strong bilaterally, and the radial pulses. They're nice and strong bilaterally. Okay, so then the next thing that we want to do is we're going to assess the back and the posterior chest. Can you turn around for me? All right, so I'm inspecting the back itself, and I'm just looking at the symmetry of the thoracic cavity. I don't notice any kind of lesions, nodules, or any kind of abnormalities. The hair is distributed nice and evenly. So the next thing I want to do is palpate for tenderness. Let me know if you have any tenderness in the back. Any tenderness?
No.
No tenderness is noticed, so we'll palpate at the posterior vertebral angle. Any tenderness?
No.
Any tenderness?
No.
Okay, so that's definitely nice and normal there. So then the next thing that we're going to do is we're just going to be inspecting the posterior lungs. I'm assessing for the rise and the fall of the chest with respirations. And I'm looking that there's no accessory muscle use, no respiratory positioning for optimal respiratory effort. I don't see any orthopnea, no hypnea. So the next thing that I'm going to do is I'm going to palpate the expansion. Place my hands at about the 10th rib and have you take a deep breath. Inhale and exhale. Okay, so I'm noting a symmetrical expansion of the chest bilaterally. So the next thing I'm going to assess for is tactile thermitis. I'm going to place it on the sides of my hands on your back. Have you say 99 each time you feel me touch?
99, 99, 99, 99, 99.
And I do note equal resonance throughout the lung field, so that's nice and normal. All right, so the next thing I'm going to do is I'm going to be percussing the posterior and lateral lung fields, and I'm assessing for any kind of donuts or any kind of atelectasis. Okay, that felt nice and normal there. I don't feel any abnormalities there. So the next thing I'm going to do is I'm going to assess a diaphragmatic excursion. So what I'm having you do is inhale deeply for me and hold it. Okay, exhale completely and hold it. Okay, so that's about 4 centimeters. You can breathe normally, and we know that normal is 3 to 5. I'm going to repeat on the opposite side. Inhale deeply and hold your breath. Okay, exhale completely and hold it. Okay, so that's also about 4 centimeters, almost about 3 to 5 again, between T9 and T12, so that's normal. Next thing I'm going to do is I'm going to auscultate the posterior lateral lung field. Take a deep breath for me. Okay, so the posterior lateral lung fields are nice and clear. I don't know any kind of breezes, wells, bronchi, or rubs. So we'll move on to the assessment of the anterior chest, heart, and lungs. Can you turn around for me? So we're going to start off initially. I'm going to auscultate the anterior chest and listen for the breath sounds. Okay, so that's also nice and normal. I don't notice any kind of wheezes, rails, bronchi, or rubs there. So now what I'm going to do is I'm just going to be assessing his respiratory effort. I'm looking for equal rise and fall of the chest, and I don't notice any kind of accessory muscle use, and I don't see any kind of dyspnea or labored breathing. There's no obvious pulsations or heaves. So the next thing I'm going to do is I'm going to be palpating the chest wall for any tenderness. I'm also going to be palpating the apical pulse, the point of maximal impulse, and I will also be palpating along the precordial. Any tenderness there?
No.
All right, so the apical pulse is about the midclavicular line, about the fifth intercostal space, and it's nice and normal. And then we'll palpate along the precordium and also along the base of the heart. And I don't feel any abnormalities there. So the next thing that I want to do is I want to assess tactile firmitis of the anterior chest.
99, 99, 99, 99, 99, 99, 99.
And again, equal resonance was felt throughout the chest there. All right, so the next thing that I'm going to do is I'm going to be percussing the borders of the heart. And, sometimes it's a little difficult to determine cardiomegaly, and it's maybe not necessarily reliable, especially based upon the patient's body evidence. Okay, so I didn't note any kind of abnormalities there. The next thing that I want to do is I want to auscultate the heart sounds. Aortic, pulmonic, Erb's point, tricuspid, and mitral. Okay, that was nice and normal, S1 and S2. I didn't hear any splitting. I didn't hear any gallops or any kind of rubs there. So the next thing we're going to do is we're going to assess the abdomen. I'll have you lay down for me. So I'll start off initially by inspecting the abdomen. I'm assessing the contour. I'm looking for any kind of obvious pulsations or any kind of heaves. And I don't know any of that there. Also, I'm looking at the hair distribution on the abdomen, looking at the abdominal veins. I don't see anything abnormal there as well. So the next thing I want to do is I want to auscultate the bowel sounds in a minimum of 4 quadrants. I'm also going to be auscultating the renal arteries as well. I mean the abdominal arteries, which is the aorta, the renal, the iliac, and the femoral. Aorta, renal, iliac, femoral. Okay, so that was all nice and normal. I didn't also take any kind of bruise. So the next thing I'm going to be doing is I'm going to be percussing the abdomen for tone. I'm going to be percussing for liver borders and for splenic domes. Liver is about 7 centimeters, almost about 6 to 9. So I'll have you go ahead and lay on your side. Okay, so that's nice and normal there. You can lay back on your back for me, please. So then the next thing that I'm going to do is I'm going to start with light palpation. And I'm also going to palpate the aorta for an aortic pulse, which is nice and strong there. So let me know if you feel any tenderness. Any tenderness?
No.
Okay, so the next thing I'm going to do is going to be deep palpation. I'm going to be assessing for any kind of organomegaly, any masses. I'm going to palpate the liver and the spleen and the kidneys as well. After the liver, can you hold your breath for me? Okay, you can breathe. The liver is nice and smooth. I don't feel any kind of nodules or lesions. For the spleen. And I actually do not feel the spleen. If I had felt the spleen, it would have been an abnormal finding for the right kidney. Feels nice and normal, nice and smooth. Left kidney. Okay, that feels nice and normal, nice and smooth as well. So the next thing that I want to do is I want to assess the abdominal muscles. So what I'm going to have you do is I'm just going to have you lift your head up there. And I'm just looking for any kind of protrusions, any kind of pulsations or heaves or anything of that nature. I don't see anything there. I'm going to palpate the abdominal muscles as well. And they feel nice and even and symmetrical. I don't feel any herniations or any kind of protrusions with the abdominal muscles. You can go ahead and sit up for me. So the next thing that we want to do is we want to assess his musculoskeletal system and his legs and feet. So I'm looking initially at his legs and feet, and I'm looking at the hair distribution. It's nice and normal. I'm looking at the muscle mass. They're nice and symmetrical. I don't note any kind of edema as well upon visual inspection of the legs. So the next thing that I want to do is I'm going to palpate down the leg. And both legs are nice and warm. I don't feel any edema down the legs or down to the feet. I have a capillary refills less than 3 seconds. It's nice and brisk. And the toenails are nice and clear. I don't see any cracking or splitting of the toenails. So the next thing that I want to do is I want to palpate the pulses. We'll start with the palpatile pulse. Nice and even, bilateral, nice and strong. No issues there. Posterior tibialis. Nice and normal bilaterally. They're equal. Dorsalis pedis. Nice and normal bilaterally. I don't notice any kind of abnormalities there. So the next thing that we want to do is we want to assess the reflexes. So we'll start with brachial. Nice and normal there. Nice and normal there. The knee. Nice and normal there. Nice and normal there. And the Achilles. Nice and normal there. Nice and normal there. So that's what we want to see there. So now we're going to assess his muscle strength. I want you to close your eyes and place your arms palm up. Okay? No palmar drift noted. That's nice and normal. You can open your eyes. Put your arms up to your chest. I want you to squeeze into me. Push me away. Okay, so now I want you to put your arms up kind of like a chicken wing. Okay? And push up. Push down for me. Okay, nice and strong. Extend your fingers for me. And squeeze. Don't let me squeeze. Don't let me squeeze. Perfect. That's nice and normal. So we'll assess the leg. I want you to push away. Squeeze back in. Push down with your feet. And push up. Okay, so that's definitely nice and normal, very strong there bilaterally. So now what we're going to do is we're going to assess the cervical and lumbar spine. If you stand up and turn around for me. So I'm inspecting the spine itself. It's midline and it's straight. I don't notice any obvious protrusions. I will palpate the spine for any kind of tenderness. It feels straight. There's no abnormalities noted. Can you lean over for me and touch your toes? I'm assessing the curvation of the spine. It's nice and straight. I don't notice any scoliosis. Stand up for me. And again, we're looking at his posture. I don't notice any kind of kyphosis or slouching, so that looks nice and normal. So that concludes our assessment. Thank you very much.